Hi, this is Markeitha, and welcome to Healthy Living. Welcome back, everyone. You can contact me at healthyliving.company. There at my website, you'll see several things. I have products. I have Keita's egg toast. I have Keita's gumbo. Gumbo comes with hot water, cornbread, and rice. So I would like to make that fresh for you. So you would have to send me a message on my website or Facebook, or contact me here at the Next Level Studios at 310-549-1113, 310-549-1113. Now, the producer of the show is T-Jams. That's T-J-A-M-Z. And you can reach him at tjamsmusic.com. There he has a whole list of songs. You can write lyrics to it, send him messages. He does the website design. So you can also reach him at the Next Level Studios at 310-549-1113, 310-549-1113. Now, if someone missed the live broadcast show, they can always go to the website, healthyliving.company, click on the previous tabs, and you can watch the show at any time. Facebook, you can also watch at any time. It'll be posted there as well. Okay, so I want to talk to you guys about staying safe. You know, the pandemic's not over, so you still got to be safe, and you still got to wear your mask. Now, I get most of my information from the CDC, from Medscape website, and then also the World. That website is where I usually get my statistics for the coronavirus number updates. So, according to the World, as of today, the U.S. still leads in cases and deaths. So people are still dying every day. We're still getting cases every day. But across the world, worldwide, we have 167,362,130 cases. That's worldwide. That is a lot. Now, deaths, we have 3,475,053. Those are deaths. Now, there's been several million that have recovered, but nobody should want to get the coronavirus because you have lingering symptoms for a long time, and some of the permanent damage is there in your lungs, so you don't want to get COVID. But those that have recovered, it's 148,377,916. Now, the U.S. is the leader in all cases and deaths, still to date. So for cases, the U.S. has 33,882,787. Deaths, we have 603,896. Now, the third leader is Brazil in cases. They have 16,047,439, but they're the second leader in deaths with 444,291. Now, India, you guys have seen, they're out of control over there. They're the second largest in cases. They have 26,738,220. And as far as their deaths, they currently have 303,355. And it's continuing to rise every day. So the U.S. is now helping them with getting vaccines and oxygen and different supplies that they need, PPE, to help protect them. They're in the crisis we were at when we started last year. Now, the coronavirus is a severe respiratory syndrome coronavirus. It's SARS-2, COVID. Now, it's a new virus. It's a new novel virus that was identified December 2019, which is where we get COVID-19, because that's when it started. It started in Wuhan, China. The World Health Organization declared a public health emergency of international concerns on January 30th, 2020, and later declared a pandemic. The World Health Organization declared a pandemic on March 11th, 2020, because it has spread to more than 19 countries and territories. So the outbreak originally was linked to, they thought, seafood with live markets, because then they figured it came from animal to person. Also, Medscape, they went to do a joint investigation with China, different researchers across the world. On April the 9th, they went to Saigon. And a joint China World Organization study for COVID-19 They wanted to see where it came from. They wanted to get more answers. And so this is going to require rigorous investigation with or without Beijing involvement. A group of international scientists and researchers. The joint study said that the likeliness of transmission rooted from SARS-CoV-2, the virus can be caused from COVID-19 involved bats and other wildlife. That's what they initially thought. But many theories suggested animal to person, but then it started spreading to people giving it to people. So now they know it's person to person, and this is where we are. So it can cause anywhere from mild to severe symptoms to death. So it's nothing to play with. Now, some of the symptoms may appear within 2 to 14 days of your exposure to someone who had COVID. The incubation period, the medium incubation period of COVID is from 4 to 5 days. Most symptomatic people will experience symptoms within 2 to 7 days after exposure to someone who's COVID positive. Now, people are considered fully vaccinated. Please pay attention to this. Fully vaccinated. That means if you had Pfizer or Moderna, you have to get 2 shots. A lot of people have only received 1. We had about 100 and maybe more now, 145 million people who got the first shot, but there's only 93 million who only has 2 shots. So we still got a long way to go. So, and then the Johnson & Johnson vaccine, that's only 1 shot. So fully vaccinated means you have to have 2 shots from Moderna or Pfizer and 1 shot from Johnson & Johnson. That's when you're fully vaccinated 2 weeks after your 2nd shot. That's important too. So be mindful of that in order to keep doing your precautions and following your 6 feet social distance and washing your hands. You have conditions that are taking medication or weaken your immune system. You may not be fully protected if you're fully vaccinated. So you need to consult with your provider, and your provider will give you instructions on what you need to do and what precautions you need to take. I do not recommend traveling with people, but people are going to travel, so I'm here to present you with the information to help keep you safe since you want to travel. You have to be fully vaccinated if you want to travel. You should still follow CDC recommendations for traveling safely, including wearing your mask over your nose and mouth. Remember, nose and mouth. Some people will have it under their nose. No, you have to wear it over your nose and your mouth. All of it has to be covered. Okay? And you must stay at least 6 feet apart from others and avoid crowds, washing your hands often, or using hand sanitizer. Now, people with an increased risk of severe illness, some people are more likely than others to become severely ill. Older adults, they always say 65 and older are more vulnerable, which we found that out to be true. Also, older adults that are 50 and older are still at high risk, but the 85 and older are 8 out of 10 deaths that has occurred in the U.S. were 65 and older as well. Now, medical conditions like cancer, chronic lung disease, including COPD, asthma, that's chronic obstructive pulmonary disease, asthma, moderate or severe. Now, what's important for children and adults, you have to make sure that your inhalers are not expired. So on your actual canister, you'll see the black area, and it'll tell you the expiration date. And then just below that, it gives you a counter to tell you how many puffs are available. So you want to make sure you keep a current inhaler that's not expired, so when you need to use it, you can use it. Okay? Also, if you have interstitial lung disease, cystic fibrosis, pulmonary hypertension. Now, they have where mental health is considered being more vulnerable because they need assistance with following instructions. Dementia and other neurological disorders, Down syndrome and other mental health disorders. So you would have to help them to make sure that they're staying within their guidelines. Alzheimer's, of course, because you're not remembering anything that's current, and then eventually you lose all your memory. Also, diabetes type 1 and 2, heart conditions such as heart failure, coronary artery disease, cardiomyopathies, or hypertension. HIV, these are the ones that are immunosuppressed. So if they have HIV or AIDS, of course, those also are more vulnerable. Primary immunodeficiencies caused by genetic defects that that you're born with or inherit throughout your family. Prolonged use of corticosteroids, it also decreases your immune. So you want to talk to your provider if your provider is giving you steroids to see what your plan is to keep you safe. Medication can lead to secondary or acquired immunosuppression. So this is what I was talking about with the steroids. Chemotherapy, you have to wait a certain length of time, sometimes anywhere from 2 to 3 months before you can get vaccinated if you're not vaccinated. But consult with your doctor and your oncologist will let you know. Also, liver disease, alcohol-related liver disease, non-alcoholic fatty disease. You get fatty disease from excess weight. So if you're obese and severely obese, you can start getting fatty deposits around your liver. Especially cirrhosis of the liver comes from alcohol. So you want to decrease your alcohol consumption, your substance abuse, and you want to make sure that you're staying healthy. That way, help your liver stay safe. Scarring is caused from the cirrhosis of the liver. It causes scarring in your liver, and eventually your liver will not function. So you don't want that. Also, overweight and obesity, which is defined if your BMI, which is your body mass index, is greater than 25, and then you're with moderate to severe is 30. Severe is actually greater than 40. So you want to make sure you get the exercising. At the end of each show, there is easy motion exercises that you can do. So stay tuned until we get to the end, and you can participate with me with the exercises. Now, pregnant women, they have some concerns with that, so speak to your obstetrician and they'll guide you on that. Sickle cell anemia is another one, as well as thalassemia, which is another inherent type of anemia. So you need to speak with your doctor. I usually take B complex to help me with my anemia. Smoking is an increased risk. Also, blood organ, like if you had an organ transplant or if you had a blood stem cell transplant, you're more vulnerable at this time. Your immune system is a little lower. Stroke or cardiovascular disease, there's increased chances of stroke because COVID tends to cause a lot of clots. So you want to make sure you respond right away. If someone is not responding to you, they're more confused, their face is drooping, or they can't walk normally, get them to the ER as fast as possible. Now, children also have been affected with COVID. Some children develop mild illness, and then some don't at all, but then some develop severe illness, which is suggested from they have the same different medical complexities that adults do when they are more vulnerable, the same conditions as we stated. But usually what happens with the children, they have what they call multi-inflammatory syndrome. This means that their organs are getting very inflamed until eventually their body shut down. So if your child is sick, having symptoms, fever, all of a sudden they're too tired, they can't wake up, they're holding their tummy with stomach pains, they have rashes on the palms of their feet and on their hands. So any changes like that, you need to get them to the doctor. Especially shortness of breath. You really got to get them in because that's a problem. One way to keep your children healthy, because anyone who's under 12 cannot get vaccinated. So that means the adults, it's on you. It's up to the adults and the older teens to get vaccinated to protect their little siblings, because right now they're not able to get vaccinated. Per the CDC, what is severe illness for a person with COVID? That means that they have to be hospitalized or go into intensive care or then maybe even die. People at increased risk for those live or visit with them need to take precaution to protect them from getting COVID. So if you know somebody in your family is vulnerable or 65 and older, then you need to definitely take extra precautions so that they don't get sick. Now, according to the BGR website, the coronavirus trends in the U.S. is not good. There are 12 states that are having large numbers of COVID positive tests. And that's because a lot of testing is not being done right now. Probably if we did more testing, we may have more people that are testing positive that we don't know about yet. Okay? Especially Mickelson says that it appears that an increase in testing around the country has uncovered the new COVID test, which is in sort of a good sense that gives health officials greater vulnerability into the spread of the virus. So testing always alerts everyone to where our vulnerability is and where there's greater population with positive COVID tests. So right now the move is to get vaccinated. And remember, you got to finish your fully vaccination with 2 shots or 1 shot, and after 2 weeks. More target mitigation needs to be done once they find out there's clusters. So we have these 12 states. We also have India and Brazil. So, I will mention the different states in a little bit. So what's happening, people need to still take the precaution. According to Mickelson, while the 72% increase in daily new cases over the past 7 days is getting a lot of attention, this can be explained completely, but more testing needs to be done daily to increase it. So it's up to 23%. So now in California, we're like around 0.3, 0.5%, but we're not testing as much right now. So we need to start testing as well as vaccinating people. So you have symptoms, go get yourself tested. This comes as the U.S. nevertheless is just hitting a grim milestone of the coronavirus a few days ago, with the country recently topping 200,000 deaths. That's a lot of people that have died. Officials are attributing this to the COVID, and it's COVID related. Now, that is according to a team of researchers that are tracking the pandemic and casualties at Johns Hopkins University. Infectious deaths from COVID-19 positivity rate has actually been dropping in many states in recent weeks, though public health officials like the White House advisors with Dr. Anthony Fauci has been warning repeatedly that the U.S. is not getting its number of daily new infections down far enough to be past to prepare for the pre-fall and winter. So we got to get our numbers down. We really got to get everybody vaccinated. It's only about 40% of us that are vaccinated. So that is not enough. We got to keep going. That is because we're expected to be hit with the flu. So you're going to have the double whammy with the flu symptoms as well as COVID. So that's going to have people at more increased risk. So we really got to be mindful of that. And they're both respiratory diseases, right? Flu attacks the lungs as well, and so does COVID. Those are the primary locations that they fight most. According to the data from Johns Hopkins, these states comprising almost of half the U.S. have been seen that their coronavirus infection rates have been raised over the last 7 days. Now, the 12 different states are Arizona, Colorado, Idaho, Ohio, Kansas, Minnesota, Montana, Nebraska, Nevada, New Jersey, New Mexico, New York, North Dakota, Oklahoma, Oregon, Rhode Island, South Dakota, Texas, Utah, Wisconsin, and Wyoming. So it's not over yet, everybody. You still have to know that the pandemic's not over yet. So we still got to do safety precautions. Now, in some of the territories like Brazil and India, you've been watching how India is totally out of control right now. They're having so many deaths and cases. It's so hard for them to even keep up. They were like us when we were last year, and now they are. The virus outbreaks in California, workers, say for instance you're a worker and you wearing your mask and you are serving people, and then so employers now are wondering how far to push back. Well, I'm going to continue to wear my mask. So the conversation is you want employees to go back into a congregate setting because you're in an enclosed area. There needs to be conversation about the safety and people, safe practices, barriers, and wearing masks, because you don't know who's vaccinated and who's not. And at this point, employers can't mandate their staff to get vaccinated. So you don't know who's vaccinated or not. Now, LA health officials say that most common COVID-19 variants are concerning, circulating in LA County at this moment. The UK variant is here. Also, South African and South African is here as well. And it said all the specimens tested, 43% of the specimen analyzed in public health laboratories was from the UK type of coronavirus. This is the variant. Remember, we talked about variants. So this is the variant that's in the LA County. The county Department of Public Health said Saturday variants discovered in Brazil and South Africa are also detected. So we have 3 bad variants right now that's been detected in the U.S. and in LA County. So we have the UK, we have the Brazil, and South Africa. So it's not over, okay? The department says the findings highlight the need for continuing precautions, especially those who are not vaccinated didn't get their vaccination. So you're still going to be even more vulnerable. And remember, the variants are more higher transmissible, meaning you can get it easier than the prior one. So these variants are more transmissible. Now it says the research shows that available vaccines are highly effective against the variants right now circulating in the county. Once strategizing open COVID, the county of 10 million residents on Saturday reported 14 new deaths and 265 new cases. There are 330 people hospitalized and 24% were in intensive care units. That's a pretty big jump. So it's not over. Statewide, more than 36 million doses of vaccines have been administered, meaning given shots in arms. 16.5 million people are fully vaccinated. California is planning to reopen on June 15th, no longer requiring social distancing in line for full capacity in businesses. Now that makes me nervous because we don't know who is not vaccinated, and you telling people to take off their masks. New federal mask guidelines that say fully vaccinated Americans can go maskless, take off the mask in settings, increase risk for more people catching the coronavirus at work or in public, or leading experts are concerned that we're taking off of these masks. Dr. Jeffrey Dukin, a physician at the Infectious Disease Society of America, says that the Center for Disease Control Prevention's latest guidance was scientifically sound, but that the Public Health Agency had not given enough details in its guidance to allow for impressions that mask mandates have been lifted. So people are not hearing the part about fully vaccinated can remove their mask. They're not hearing that. They're just hearing that the mask can be removed. So you have to pay attention. Therefore, the guidelines could lead to increased risk in public spaces and workplace with preventable COVID-19 spreads, primarily among the unvaccinated. He said that at a press briefing Thursday hosted by the Infectious Disease Society of America. So, because you don't know who's vaccinated or not, this is still an increased risk for not only you to get the variant. Even if you're fully vaccinated, there are some breakthroughs where people have gotten COVID as well. But especially the ones that are not vaccinated, they have an increased higher risk because they're not vaccinated. Now, CDC guidelines recommended that unvaccinated people still wear masks. Regardless, the recommendations are not legally binding. Now, businesses and different states are allowed to make their own rules. So if a state or business is not comfortable because they can't ask you if you vaccinated, they may mandate you to wear your mask. So just be prepared that it's not over and they can still ask you to wear the mask. So don't get mad at them. We have a pandemic. People are dying. So do not be surprised, okay? Now, Dutchin also said that information from the CDC was suboptimal. The return to normal activities is safe for vaccinated people. Remember, and actually fully vaccinated people. 2 shots or 1 shot, 2 weeks after either your second shot or after your first shot if you have Johnson & Johnson. So telling them to return to normal activities, but that's not appropriate. People are not listening to the fully vaccinated statement. There is no debate about the fact, however, the announcement led to widespread confusion and frustration because it was unexpected and needed content. Duggan said society liaison from the CDC Immunization Committee said there was no information on how to apply the guidance in practice, particularly related to the inability to verify vaccination status. You know, because you can't mandate that they ask you, hey, you got to show your vaccination card. And then be mindful, there's a lot of people out there that are using fraudulent vaccination cards, like they got it, but they're not real. So be mindful of that too. Duggan suggests that the CDC should have issued a blanket statement, should have introduced a blanket statement, but instead made recommendations according to the number of coronavirus cases or the proportion of vaccinated people in an area. So a lot of people were confused. They figured take off their mask. So they out there partying with thousands of people and cluttering all together, especially younger adults. So it's not safe to do that yet. So far, less than 40% of the Americans are fully vaccinated. Less than 40%. So that's not enough of us to be vaccinated for us to be out there running around without a mask. Americans are fully vaccinated. According to the CDC, less than 30% of the people in Wyoming are fully immunized. So some states are less than other states. So they're even at a higher risk of getting the COVID again. Now, coronavirus variants called escape mutants threaten to undo all the progress. So we're already concerned about the variants because they're more transmissible, meaning you can get it easier, right? Most states, however, follow the CDC, the more relaxed guidelines. Dutchin, who is also the health officer for King County in Washington, which includes Seattle, they have issued a directive on Thursday that strongly urges all Washington population older than 5 years old can continue to wear face coverings indoor public spaces. Washington's Governor Gay Instill said that the wake of the COVID, the CDC update on May 13, that individual businesses might require masks and vaccinated people, but there was no state requirement. Dutchin told the University of Minnesota Center of Infectious Disease Research a policy that King County needed more time to get disease rates down and vaccination rates up before doing anything that the world weakens our indoor mask mandates. CDC guidelines make absolute sense in many areas, but many places are not there yet, he said. That means, see, we only have 40% of people fully vaccinated. That's what's important, fully vaccinated. Duggan's comments followed a joint statement with the DISA and the HIV and the Medical Association issued. These are the people connected to the vaccination committees. Monday acknowledged that the CDC recommendations were based on science, but said the CDC should not send the message that the pandemic is over. And I really don't think they sent the message that it was over. I think CDC provided guidelines to wear masks if you're not fully vaccinated, and you can remove your mask if you're fully vaccinated. But people are not going to hear that. They're missing that part of it. All they want to hear is removing a mask. Now, according to the Insider's area, Bendex report May 13th that other experts say CDC guidance was too broad. Dr. Elena Wynn, a former Baltimore health commissioner who is contributing to the columnist at the Washington Post and a medical analyst with CNN, told CD Rap that the CDC got the science right, but the policy and communication was easily wrong. There are unintentioned consequences that can endanger people and the distrust in the CDC, says Dr. Nguyen. Dr. Anthony Fauci said Wednesday that people were misinterpreting the CDC guidelines, but that it wasn't the CDC's fault. People either read quickly or listened and heard half of it, Dr. Fauci says. They are feeling that they were saying that you don't need to wear a mask anymore. That's not what the CDC said. So this is where the confusion came, because they said you can take off your mask if you're fully vaccinated indoors. But they didn't want to hear the fully vaccinated. They only want to hear take off your mask. Now, read the original article on Business Insider. More of the virus outbreaks. Climbing Guide says at least 100 virus cases of ever less despite Nepal's denial. So in Nepal, reporting 8,607 new infection and 177 deaths on Friday, bringing the total since the pandemic began more than 497,000 confirmed infections and more than 6,024 confirmed deaths. Now, Nepal, the switch government has flown $8 million in equipment, supplies to combat the COVID, like we had to do, to help Nepal, which is struggling right now with their health system. They even have one of their hospitals burned down, and several patients and 2 staff died. They have acute shortage of hospital beds, medication, and oxygen. And we all been watching that on TV, that they are running out. Some people are dying because they don't have the oxygen. So now we're sending them help. Hopefully they can get their vaccines faster to their population and people can start on a healthier trend. They did shut it down because there was too much of an outbreak. The Swiss ambassador in Nepal says that shipment containing 40 ventilators, oxygen concentrator, 1.1 million coronavirus test kits, face masks, gloves, and protective suits. Nepal has been appealing to the international community for several weeks now because they are out of control and they don't have enough to take care of their citizens. Since the coronavirus 19 situation worsened sharply last month. So they're in lockdown right now. Nepal has recorded nearly 500,000 coronavirus confirmed cases and 6,024 people have died. So what this means is that people have to truly listen to the guidelines that the CDC is providing. It's fully vaccinated, but no one knows who's vaccinated and who's not. So I'm going to continue to wear my mask to be safe. The 7-day average for new cases dropped from 30,000 per day this week. CDC Director Rochelle Walensky says cases have been hasn't been this low since last year. So we are doing better in certain states, but not all states. We still have 12 that are still having problems and increasing in case and deaths. So we have to be mindful of that. CDC Walensky. Okay, so then we're going to take a break. And when I come back, we're going to do some easy motion exercises. So stay tuned for that. And you can follow along and participate in the exercises. Okay, I'll see you in a few minutes. Yeah. And I'll wrap it back up with masters or whatever. about right, or pull it down more? So what? Yeah. Okay, hi, and welcome back to Healthy Living. Okay, so as stated before the break, I'm going to demonstrate some easy motion exercises you can do while you're lying, sitting, and standing. So there won't be any excuse not to exercise. So while you're on your couch or your bed, put your back against your bedboard. If this is new for you, then you can do 3 sets of 10s, always holding your ab when you do any of your exercises. And then when you get more advanced, you can scoot down more. Do the same thing, holding your ab, and you work in your arms as well. And then you can go all the way down when you get really good, right? Hold your abs in and come up, right? Okay, let's finish the lying down ones. Okay, so get with it. So since we're here, let's have your palms down. You're going to do some pelvic tilts. So you're going to lift up, right? You can hold your abs in. You can do 3 sets of 10s, or you can hold for 30, which is more isometric because you're not moving. You're holding in your muscles, your abs. Now, when you get a little bit more advanced, you can do the same thing, but what you can do is keep your buttocks tight, abs tight, and slowly lower your feet while you're still holding yourself up, okay? So that's good for the core. You want to increase that part. So another thing, since we're here, for this part here, for this inner thigh meat that rubs when you walk, open your legs and just open and close. That's for this part right here. It helps that part, right? Now, another thing you can do, since we're here in this position, you can also lower one leg to the side, wherever you can go until you can go all the way, right? And now remember, you got to do it for both sides so it's even, okay, for both sides. So, put my mic on. Okay, so now another thing, since you're here, what you can do is you can go with both of your knees to the side. So wherever you can go, so you can go lower, go all the way. And this is for your love handles on the side. This is also a good warm down at the end of your exercise. So this is for the love handles right here. Okay? Now, another thing we can do, you can do your scissors. You can do them on the ground. You can lift up and do scissors. You can crisscross them, hold your ab in, right? You can do all of that. Now, you can do leg lifts low, rotate, and then you can do higher when you get better, right? Higher. And then you can do them together. You can do low, medium, high, all the way, until you can get good all the way, right? Pull your ab in all the time, right? Now, another thing you can do, you can get a resistance band, or you can do it without the band until you get used to it. You can put it just above your knee. You can turn on your side, right? Now you want to make sure that you take your hip and you roll it forward. So I usually take my arm and put it this way. That way I know my hip is rolled forward. And then you can just lift. You can do 3 sets of 10s, or you can hold it. And then another way, you can stretch it out, and you can do 3 sets of 10s, or you can hold it. Remember, keep that hip over, right? And then you can go to the back. Keep the hip over, and you can do the same thing. 3 sets of 10s, right? Okay. Now remember, you got to do both sides. I'm just demonstrating one so we can get through it. Now another thing that's good is on your abs is what you want to do is you want to raise your heel up. You can start with one at a time. And if you have a knee problem, you might not be able to go all the way. So go where you can go if you have a knee problem. Until then you can get both of them up. This is good for the back fat, your back of your buttocks and your thighs, for those wound craters. Okay, so that's that one. Now, let's do some. I'm gonna do some standing. Alrighty. Okay, so standing. It's important that you increase the strength of your core, meaning your abs, your buttocks, and your thighs. So what you want to do is you want to try to hold yourself up for 30 seconds. So you can either get a stable dresser or your bed, not a wobbly chair because you don't want to fall. Huh? Hold on just a second. Okay, so what you do is you hold on because you got to get used to it. And then you want to hold yourself up for 30 seconds, right? So if you're not strong enough, then you're going to have to hold on because I don't want you to fall. But you have to get to where you have to hold yourself up for like 30 seconds. And do the same thing on the other leg, right? And you don't want to cheat and do this. You want to keep your leg out and hold yourself up. So none of that. So if you have to start over, then start over, right? And then hold yourself up. That increases your core. So hold your abs in, hold your buttocks in, and your thighs. Okay, another thing you can do is leg lifts. Side leg lifts. Lift up on both sides. Hold your abs in, and you can do lifts. Can't go all the way. Go where you can go until you can go higher. Okay, so you can do that. Now, another thing you can do while you're standing is these are like chair squats, standing squats. So when you're at work, make sure your chair is secure, and then you just sit down and you get up. And you sit down and you get up. Those are still squats, right? Because you're getting down and you're getting up. Now while you're standing, you want to make sure you have a broad space, right? Make sure you have a broad space. Okay, so you want to spread your legs apart for a broad space. And so what you want to do is go down and touch the ground. So if you're having back problems, then go slowly. Okay, so just go slowly where you can go. If you can't go here, go to your knees. You can go to your thighs, your calves, the top of your feet until you can go to the floor. So just make sure, like I said, if you have back problems, go slowly so you don't get back spasm. Okay? So the other thing you can do is mix it up some. You want to go to the side, right? So go to the side wherever you can go, right? So that's another one you can do. Now, standing also, you can march in place. So you can get weights and you can start marching, right? You can work your arms while you're marching, right? You can start low, you can start high, you can swing your arms up. Now, if you don't have weights, don't worry about it. You can get you some water bottles. You can get some canned vegetables, canned fruit, whatever you need to do to provide a little bit more weight for yourself, right? Okay. Now, another thing you can do is toe lifts. So what you want to do is push up. And if you need help, then you might have to hold on to a chair or the sofa or your dresser or whatever, because you want to get all the way up. And if you can't get all the way up, then you can do the little ones. But it's better if you go all the way up. That's good for your calves, and it's good for your ankles. So those are some other things you can do while you're standing up. Okay, these lifts on your toes, all the way up to the bottom, actually the bottom of your palm of your foot at the top before, because you don't want to be totally on your toes. Alrighty, now let's get to some sit down. Okay, these are exercises you can do while you're sitting. So while you're sitting, let's do those same sit-ups, right? So you can go down to the chair while you're sitting. You can go up and down and make sure you're moving your arms, you're opening and closing, right? So these are ones you can do while you're sitting. Then you're going to go to the side, but I don't want you to twist. I want you to just reach for the side. So you're going to go to the side, right? Because you want to work the entire ab muscle, the lateral and the medial, right? Now, another thing you can do while you're here for this inner thigh, just like we had when we was lying down, you just open and you just close. It's for this inner thigh. Now, another thing you can do to get more tension on it is to put on a band, retention band, and it makes it a little harder, right? Now you can also hold it there and make it isometric as well, but you can open and close, but you want to not go all the way because you want to keep it apart, right? You want to put more tension, then you can keep it apart further and don't collapse all the way, depending on how strong you are and what you want to do at first. But if you don't have that and you're not used to it, then you don't have to use it. You can do it without it. Now, also, just like we had the standing marches, you can do individual lifts, like lift up on your toes, right? I call them marches. So you're lifting up on your toes and you're doing your weights on your arms at the same time. You can do individual or you can do them together. It changes, you change it up a little bit. And the good thing about this is that you have to do a variety of different types. Don't do the same ones because your body gets used to it. Now there's the 3-point or 4-point lift where you can lift your leg up, straighten it out, bend it back, and put it down, right? Up, out, up, down. You can do those. Up, out, down. Up, out, down. All this is why you're holding in your abs, so remember to do that, okay? Now, you can also do, your basic scissors, right? Crisscrossing of your scissors. You can do the single lifts, right? And then you can also do double lifts. You can do where you are lifting both feet up. So you can do little ones, right? Holding your abs, go higher, and then higher. However far you can go, you can do that. But you may not be able to go that high at first. But it's definitely a little harder the higher up you go. And then you can hold it there for isometric exercises as well. So you can do that as well. Now, to work your arms, you can get a retention band tied in the middle. And you can put one hand on the knee. And then this one you can do curls with, right? And to make greater resistance, you move your legs further apart, it makes greater resistance. So then you have more resistance, right? And then for the opposite, you do the same thing. You just rotate the different position of your hand. Either it's going to be up or it's going to be down. So if it's down, it's on your knee, and the one that's up is doing a fist, and that's the one that's going to do the curls, right? That'll be good for your arms. And you can go further. Depends on how much resistance you want, right? So the more you do further apart, the higher the resistance is, right? Okay. Now, there's another thing I want to introduce you to. It's called my QB, and it's a peddler. Now, before, I couldn't even lift this up. But you know, the more you work out and the more you do, the stronger you get, right? So the good thing about this thing is it has a resistance where you can make it harder to pedal as you get more use in. And you want to make sure you do increase it because you want to keep working your body more. It also has a speedometer reading, so it tells you how far you're going. So when you're sitting back watching your favorite TV program, Queen of the South, or Queen Sugar, or Superman and Lois, whatever your favorite show is, there's no reason why you can't exercise. And then while you're exercising, you do your arms as well. And if you have shoulder problems, then you should support your arms, which I do either on an armrest or I put it down on the couch by my side, and I do these lifts with my arm as well as my feet. Now, the good thing is that you can go in reverse as well while you're pedaling. And then try to remember as much as you can to hold your ab in while you're doing the exercise. So it's no reason why no one should not be able to exercise, right? There's no reason. So you have ways to exercise. And look, if you don't have the weights, like I said, you can use bottled water or whatever you have, canned food. So there's no reason why you can't exercise. Now, if you're watching your favorite TV program, by the time you get to 2 or 3 commercials, you've done 30 minutes. And then before you know it, it's a whole hour and you've been pedaling. I mean, this is a good thing, right? So there's no reason why no one should be able to do their exercising. Now, I want you to also protect yourself. You can build up your immune system by eating almonds. You can eat cashews. You can also take zinc if you need a supplement and you're not getting enough. You can take garlic as well. Now, you also can get you some blackberries. As far as the berries, the best thing to do, I usually rinse them off and I freeze them, and then I can take them out as I need them. Whether it's in a smoothie or if you want to eat it, a fruit, then that's fine. You can do that. But berries are great for building up the immunity. Now, also, you have broccoli. It's excellent for building the immunity up. So is avocados. Now, avocados is 2 different things. It helps to build immunity, plus it's a higher acid vegetable. Coronavirus doesn't like acid. So you eat the avocado. You can drink and eat lime, lemon, oranges, pineapples, grapefruits, everything that has acid, citric, right? That helps to build your immune. It helps you with that. So those are the things that you can do to help take care of yourself as well. Now, we already know that the good old vitamin C is helping a lot. It always had, even for cold symptoms. It helps you to fight it, right? So it builds the immune, as well as vitamin D. So vitamin D there's been proven research that in the hospitals, when the patients come in and they're severely ill, they give them doses of vitamin D, and it actually helps to improve their symptoms. So you want to get you some vitamin D as well. Vitamin C, vitamin D, zinc. If you have immune problems, or if you need to make sure your blood cells are staying up and producing, then you do your B complex. That's what I take every day. Now, far as sleep, you have to get enough sleep and rest. If you don't get enough sleep, your body can't regenerate itself and restore itself. So I take melatonin when I can't sleep. You usually take it an hour before you actually want to sleep. I take 10 milligrams. For children, it has to be a lot less, about 2 to 5. But this will help you sleep, because sleep is very important, and you need to have uninterrupted sleep. You need to be able to sleep straight through without being woke up. So melatonin is a good source to do that. Now, also, I want to make sure that you guys are gargling every morning. It's proven research too that that mouthwash gargling does help you. Doesn't matter which one. In the morning, cough a little bit, and then cough, and then gargle. Okay, and make sure you don't swallow what you cough up. Don't never swallow it. Spit it up, spit it out. Okay. All right. The other thing is, far as your products, you can make your own bleach spray. All you need is a third bleach, and the rest 2/3 is water. So you can buy these containers and make your own bleach spray, and have your own supply of cleaning your different products that you bring in from the mail, and plastics and paper. All that stuff, virus does settle on them, so you want to wipe down all those things. You can also get a towel with antibacterial soap and wipe down all your products. Now, if you're having problems, you can get things like the Neti-Med. You can clean out your sinuses. Use the Neti-Med. It comes with individual packages. There's other things out there that you can also use, so that's up to you, but this really does work. Now, you have to wear your mask. It's not over yet. So there's K95s out there. Nurses, we have proper fitted, tested N95s that we wear. So you will see us with those particular masks on. Now, for the public, there are N95s available online. So N95s, they have the same metal guard here, so you put those on, right? Always make sure you take your fingers and press on the side to make sure you have good closure. Now, they also recommend that you wear a second mask over your N95 if you have one. That's fine. Now, what's really important is if you have a regular mask, like these, yellow, blue, some are like bluish green. It has the metal there. You put it on. And you can do that same thing with fitting it on the side. But if you notice, there's openings there. There's gaps. So you want to make sure that definitely that you cover it with another cloth mask or something else to ensure that nothing's getting in. So they recommend that you do that. So you want to wear two, because you don't want any gaping holes, because remember, this is airborne as well. There's fine mists they travel in the air, so you want to make sure that you don't have that. Now, also, there's things called gaiters, so you can put on the mask, right? You should have at least two on. You have to cover your nose. Make sure it's not below your nose. That's not doing you any good. So you have to cover your nose and your mouth. The gaiters, you pull it on over. Right? So you pull your gaiter on, and then you pull it up to cover. And see, there's no gaps. That's what's important, no gaps. Also, I recommend that you wear goggles as well. Goggles, you want to make sure that you get the ones that are fog free. So you wear your goggles to protect your eyes, because it can enter in through the eyes with the conjunctivitis. So you want to make sure that they're indirect vent or non-vented, and wear your goggles to protect your eyes. Okay, so it's not over yet, people. I want you to protect yourself. I want you to wear your mask. I want you to make sure that you're getting enough exercise, you're getting enough rest, that you're also eating the proper foods to build your immune system up. You want to make sure that, like I said, if you're not going to eat the fruit and the food that helps to build your immune, then you need to eat your zinc. Otherwise, you can eat your avocados, your broccoli, your blackberries, your cashews, your almonds. These are great for building your immune system, right? And then also, if you're anemic or have thalassemia, or your doctor says you need to take some iron, then follow those instructions. Otherwise, take some B complex. Also, make sure you take your garlic. It helps with your immune system as well. If you can't eat it every day, then take the supplement. Zinc, if you can't find enough foods to build your immunity, take the supplement. And then also, you want to make sure you get sleep. So take your melatonin, take it an hour before time so you can get uninterrupted sleep. That's very important. Uninterrupted sleep. That's important. You want to make sure you're cleaning out your sinuses, wearing your mask, keeping 6 feet apart, because the real problem with this is that you don't know who's vaccinated or not. And people can lie and they can say they're vaccinated and they may not be fully vaccinated. And remember, fully vaccinated means that you have had all the required shot requirements. If it's Moderna or Pfizer, you need 2 shots, and then it's 2 weeks after that last dose of the vaccine. If it's Johnson & Johnson, it's 1. So you still got to wait 2 weeks after your injection. So that means you're fully vaccinated. But remember, indoors is more of a higher risk for you to get COVID, and people who are vaccinated were still getting some breakthrough COVID symptoms. So it's not over, and you need to continue to protect yourself. You need to make sure adults, make sure you're vaccinated and protected, because your small children that are under 12 are not protected yet. And the ones who just started, like the 12 and older, they're not fully vaccinated yet unless they got the Johnson & Johnson, and it still has to be 2 weeks after that dose. But if it's Pfizer or Moderna, it's 2 weeks after that second dose. So they're not fully vaccinated either. So I want you to always remember that. Fully vaccinated is what's important. But I don't want you to be out there not protecting yourself and not thinking about your vulnerable older parents or grandparents, or your younger children that are under 12. And children that are under 2 cannot even wear a mask. So you should not be out there inside buildings with your young kids and they can't wear a mask on top of that. So start teaching your children how to wear their mask indoors, because children tend to rip their mask off. So you have to teach them so that they're ready. Make sure you're carrying your waterless soap with you so that you can wash your hands frequently whenever you touch different items. So, and the most important thing about waterless soap is that you have to keep rubbing until it dries. Don't put it on and then wipe it off on your pants. Okay, that's not going to help you. You want to put it on and rub it until it dries. Now, the other thing that I want you guys to remember is that there's increases that are going on in 12 different states, and I mentioned that to you already earlier, including Nevada, Wyoming, Minnesota. A lot of these states are still having increased cases. But I think if we were to test too, we would have increased cases as well. So right now the point is focused on vaccines, but I think we need to start testing as well to test this before we start opening up. Now, they said maybe June 15th, so we'll see how that goes. But in the meantime, I will protect myself. I will continue to protect myself. And that's okay if I want to do that, because it's my choice. Now, if the ones that are out there unvaccinated, you got to know, there's a lot of people refusing to get vaccinated. So do you want to be indoors with someone that you don't even know that's not vaccinated? I would protect myself. Higher risk activities are going indoors, especially at bars, because people tend to drink and they forget about how close they are. They forget about following restrictions because they're drunk, right? That's what happens when you drink. You lose all your inhibitions. Stuff that you might have thought that was important before, you lose that when you're drunk. So that's why bars are like the last ones to just fully open, because people lose their inhibitions to keep the distance and stay safe. So make sure you're exercising every day, eating healthy, because you want to make sure that you're losing weight and not gaining weight, because obesity is a risk factor that gives you more complications when you're overweight. So you want to try to make sure you keep exercising and stay healthy. You want to also make sure you're wearing your mask. Wear 2 masks, especially to make sure that it's covered so that there's no open gaps to your mask, because it can still travel into your mask through the gaps. So you want to make sure you wear those masks. You want to make sure you do your social distancing and washing your hands frequently. Now, it's okay for you to continue to wear your mask, and then just be mindful, carry your mask with you, because some businesses are not going to let you in without wearing a mask. And some businesses will require that you show proof of vaccination. So you have to be mindful out there too that there are a lot of fraud going through the different states with these fake vaccination cards. So that's going to be another problem that's going to be a hindrance. So I would just continue to protect myself and wear the mask. Remember, there's people out there having parties, especially the young adults. They just don't listen. They think, oh, nothing's going to happen to me, but everybody is dying, even babies. So it impacts everybody now. Everybody. So no one's exempt from the coronavirus. Now, some people have had the coronavirus, so they think, oh, I had it before, I'm not going to get it again. Yeah, you can get it. There's proven research where people have gotten it a second time. So we don't know about how long these antibodies work. You still got to protect yourself. So if you're having some immune problems or chemotherapy or anything like that, then you need to talk to your doctor. But if you're under your doctor's care, your doctor will be talking to you to let you know when it's appropriate for you to get your vaccination. But it's important that we get these COVID vaccinations. But you're going to have a certain percentage that won't. So that's the group of people that I will never know who I'm running into. And that's why I'm going to continue to wear my mask too. And I'm going to wear my goggles. And I'm going to social distance at least 6 feet. So try to remember that it's not over yet. It's still happening across the world. We're still testing positive. In every county is still testing positive. People are still dying every day. So it's not over yet. And then we have to be mindful of the holidays where people are gathered, just like last year, every holiday, then the spikes went up. So hopefully people will still protect themselves, protect the vulnerable population like 65 and older, people who have medical conditions, children that have medical conditions. Please, parents, please, if your child has asthma, please make sure their inhalers are not expired, because it won't help them when they really need them. If your child is sick, don't wait till the next day, because some kids don't make it the next day. Take your child in. It's better to be safe than sorry. Contact your provider. Be honest about the symptoms. I had a child that had albuterol inhalers, but the mom didn't give the child inhalers. So I had the instructor to give it to the child. Just because you want to be in denial that your child doesn't have a certain disease disorder doesn't make it go away. If the doctor orders medications and have concerns for your child, you need to follow those instructions to keep your child safe. But if your child is having shortness of breath and coughing and fevers, you need to contact your primary right away. And if they're short of breath, then you need to call 911. Don't wait. You need to call 911. Because no child, no 2-year-old should be sitting down after about 2 minutes of playing. That's a problem. That's shortness of breath, which is not appropriate. So I'm telling you this, parents, so you can watch your children and don't blow it off. Because children, when they do get severely ill, they die faster. You heard about a 15-year-old that had died recently from COVID about 2 weeks ago. So no one's exempt. And what's happening is they have to increase pediatric beds, meaning for children, because kids are testing positive. And when they started reopening in Minnesota and I think it was Michigan, kids were going back to school. They were in sports, they were having parties, and they had an increased rise in the coronavirus. So, because people are under the impression that teens and children are not as vulnerable, but they still do get sick. So it's not true. There's proven research that kids have gotten sick and kids have died. And don't forget about the multi-inflammatory syndrome for children, where their organs start swelling and they cease to function. So kids do get sick and they can die from coronavirus. So just keep that in mind. Watch your children. Look over them. Make sure their medications are current. You can reach me at healthyliving.company. They're at my website. And you can also reach me here at the Next Level Studios at 310-549-1113. 310-549-1113. Producer of the show is T-Jams, T-J-A-M-Z. You can reach him at tjamsmusic.com. He has a whole list of songs. All the songs you hear during the show, those are songs he has produced. I'll see you in a couple of weeks. Stay safe. Continue to wear your mask. Wash your hands and social distance. Okay, I'll see you in a couple of weeks. Bye-bye. Bye-bye.